Hello, my geniuses. Welcome to another biochemistry lecture series today. It's a great science tutor, Lorenzo. And we're talking about glycogen storage disease. Hey, this is another important clinical correlation you have to know. Glycogen storage disease is important. So stick to the end of this video. I'll be giving you some important info you need for your exam at the end of this video. And there's one important thing you need here, because those that need it, if you're writing your MBBS exams, the OSCE exam, the USM, LME exams, and all medical exams you want to write, you also need these exams. You also need it. Or you are writing a MCAT exams and you need all these things. So stick to the end of the video, because I'll say some important exam questions that you always see and you always look out for. So if you are just new to my channel, make sure to subscribe and turn on your post notification button so that anytime I drop any video, you're sure to be notified. So if you want me to make any video for you, drop it down in the comment section. I promise I'll make it that video for you. So let's jump right into the video. So the first question I'll ask ourselves, what is glycogen storage disease? You can see it. What is glycogen storage disease? Glycogen storage disease are a group of inherited metabolic disorder. Don't forget it. First thing you have to underline is that they are a group of inherited metabolic disorder, which means you inherited it to the gene from either of your parents or your family. Just in your lineage is there. They are a group of inherited metabolic disorder caused by a defect in one of the enzymes involved in glycogen metabolism. So one of the enzymes that are involved in glycogen metabolism are defective here. So since they are defective, what happens? They affect us here. So since they are defective, they lead to accumulation of glycogen in the body. Causing different biochemical abnormalities. If we are to repeat it again, what is GSD? Glycogen storage disease are a group of inherited metabolic disorder caused by deficiency in one or more of the enzyme that helps in the catalyst of glycogen metabolism. So if the enzymes are out, if there are no enzymes, or maybe the gene that is coding for your enzymes are not present, your body will not have the enzymes and your body will not be able to break down the glycogen, and there will be accumulation of the glycogen causing various metabolic conditions. So hope you understand it. So it must be inherited, one thing you have to know, and there will be absence of glycogen metabolism leading to the accumulation of glycogen. So where does it occur? It occurs in the liver, muscles, and kidneys. You can see there, liver, muscles, and kidneys. Genetic predisposition. Are you getting that? It is autosomal recessive. It is autosomal recessive and rare. So it doesn't really occur, but if it occurs, usually bad. So it's autosomal recessive. It's on our autosomal gene, not the autosomal dominant, whereby it will occur in an individual. So what is the chemical pathology of this case? How does it happen? So when there's a deficiency of the enzyme, first there must be a deficiency of the enzyme, which means your gene, there is a mutation in the gene that codes for the enzyme. So when there's a mutation in the gene that codes for the enzymes, your body will not be able to break down glycogen. There will be impaired glycogen metabolism. They'll be impaired at that particular case. So when there's impaired, what happens? Glycogen will accumulate in the tissues. When it accumulates in the tissues, it will be causing different conditions, different symptoms like hypoglycemia, because glycogen is used to form glucose. So since glycogen is used to form glucose, there will be hypoglycemia, there will be hepatomegaly, there will be muscle weakness, and there will be other biochemical abnormalities. Yeah, so this one is very simple. Mutation in gene that codes for the enzymes, absence of the enzymes, impairs glycogen metabolism, accumulates glycogen, and does what? Causes various symptoms which we have discussed. So now how can we remember the types of GSDs now? Types of glycogen storage disease. Don't forget types of glycogen storage disease. Always remember, very poor carbohydrate and muscle handling. Very poor carbohydrate and muscle handling. You can use various, I gave you various mnemonic here. Very poor carbohydrate and muscle handling. Very poor carbohydrate and muscle handling. Very von Gierke. So von Gierke is the first type 1 GSD. Von Gierke. Poor Pompe disease. Type 2 Pompe disease. Very poor. Carbohydrate is Cori. So very poor carbohydrate, Cori disease. And And is what? Andersen disease type 4. Muscle, McArdle's disease. Don't forget, McArdle's disease. Handling has disease, that is type 6. But there's also type 7, which is Taruy's disease. Taruy's disease. There's Taruy's disease in type 7, and type 8 and 9 forms together and form what we call phosphorylase kinase disease. Phosphorylase kinase disease. So very poor carbohydrate and muscle handling. Very poor carbohydrate and muscle handling. So I also give you some mnemonics here when you are talking about based on the liver types. So liver loves glucose. These are the types that causes hypoglycemia. Not all of them causes hypoglycemia. Some causes hypoglycemia. Type 1, type 3, type 4, and type 6. So 1, 3, 4, 6 causes hypoglycemia. 1, 3, 4, 6 hypoglycemia. Von Gierke, Cori, Andersen, and Haas. 1, 3, 4, 5 causes hypoglycemia. 5 and 7, McArdle's and Taruy's disease cause muscles. McArdle's and Taruy's disease cause what? Muscle problem. There will be muscle weakness and it will affect most of your muscles. So based on hypoglycemia, you have 1, 3, 4, and 6. Based on muscle issues, you have type 5 and type 7. So the first type we'll be talking about here is von Gierke's disease. Don't forget, we call it GSD type 1, von Gierke's disease. Now look at the von Gierke's disease. Very, very simple. What does it do? If there's an absence of what? Glucose-6-Phosphatase. So there's an absence of Glucose-6-Phosphatase. Very bad though. If there's an absence of Glucose-6-Phosphatase, what happen? Which means there will be accumulation of Glucose-6-Phosphate. Absence of Glucose-6-Phosphatase, accumulation of Glucose-6-Phosphate. Remember, that is the last enzyme we bypassed. First of all, after bypassing so many enzymes, fructose 1,6-bisphosphatase, we now have to bypass Glucose-6-phosphatase to form glucose. So when there's absence of Glucose-6-phosphatase, what will happen? There will be accumulation of Glucose-6-phosphate. Are you getting that? And causes his inability to convert to glucose. And when you start increasing Glucose-6-phosphatase, what will happen? It will now branch to HMP shunt. So when you increase Glucose-6-phosphatase will now start forming substrates that are needed for HMP shunt. You get it now? Increasing Glucose-6-phosphatase, you start shunting it to HMP shunt, which induce the formation of what? DNA and RNA. So there will be increase in formation of nucleotides when you start increasing Glucose-6-phosphate. So instead of Glucose-6-phosphate to form glucose, it will now increase in the body. Instead of now forming ATP, it will not form ATP. It will now start entering the HMP shunt, which is the hexose monophosphate shunt. Don't forget, von Gierke's disease type 1, deficiency of Glucose-6-phosphatase. So what will happen to the patient here? Very, or again, don't forget, very is very important. Very, that is the symptoms. Very, you have the von Gierke's disease because what we call severe what? Hypoglycemia. There will be hypoglycemia because there's no glucose. Immediately the lactate level will be high. Lactic level will be high because now there will be decrease in oxygen level. Oxygen radicals will be high, so lactate level will increase, and all these things will pack in the Glucose-6-phosphate level will be high in the liver, causes hepatomegaly. And there's hepatomegaly, what happened? Due to the entrance into the HMP shunt, there will be hyperuricemia. Don't forget. Due to the inability to form glucose, there will be hypoglycemia. Due to the decrease in oxygen level, there will be formation of lactate. Now, due to the increase in Glucose-6-phosphate, what happens? Glucose-6-phosphate packs in the liver, forming what? Hepatomegaly. And if there's hepatomegaly, due to Glucose-6-phosphate forming phosphogluconolactone, which is a substrate in HMP shunt, there will be what? Hyperuricemia. Due to an increase in Glucose-6-phosphate, now there will not be high amount of dihydroacetone phosphate. Now the hydroxyacetone phosphate, there will be hyperlipidemia. So there will be hyperlipidemia because Glucose-6-phosphate will no more be producing ATP again. So now start producing other carbohydrates. It will now start producing other sources. So from the dihydroacetone phosphate, I'll enter to form what we call TAG. So there will be hyperlipidemia. From Glucose-6-phosphate, I'll enter HMP shunt. There will be hyperuricemia because now you'll be forming what we call DNA and RNA. You'll be forming AMP, GMP, all of those one. So when you start forming it, they will now be forming uric acid hyperuricemia. There will be retarded growth. There will be retarded growth in this patient because at this particular point, the brain needs oxygen, the brain needs glucose. There will be no glucose, mental retardation. Now there will be failure to thrive at this particular point. There will be failure to thrive. Are you getting now? Metabolic acidosis due to the lactate, organomegaly. Some of the organs will be what? Getting big. Gierke. You get it now? So what are the laboratory findings? So how can you know? The glucose level will drop, the lactate level will be increased, the uric acid level will be high, hyperuricemia, the TAG level will be high due to dihydroacetone phosphate forming glycerol. Your cholesterol level will be high too because you'll be forming acetyl-CoA from acetyl-CoA will condense together to form mevalonic acid. The liver enzyme will be high due to hepatomegaly. That is the AST and ALT level. So now we are done with type 1. So we'll go to the next one, type 2. So type 2 is also another important one. So remember, the first one is what? Von Gierke disease. So after you have seen von Gierke disease, what is the next person? Remember, very poor carbohydrate. So Pompe's disease is the next one. So what is Pompe's disease? Type 2. Here there's deficiency in what? There's deficiency in what we call lysosomal acid alpha 1,4 glycosidase acid. We call them acid maltase. Lysosomal acid or lysosomal acid alpha 1,4 glucosidase, which is what? Acid maltase. So when there's absence of, because now remember that glucose-6-phosphate, your glycogen, now glycogen in the lysosome is different. Glycogen in the lysosome do not need all those steps. I get him now. It just breaks down to glucose directly, and it needs this enzyme in order to break it down. So when there's deficiency of this lysosomal acid maltase or lysosomal acid alpha 1,4 glycosidase, what happens? Glycogen will be accumulated in the lysosome, and if like glycogen is accumulated in the lysosome, it will affect the heart and the skeletal muscles. So glycogen will be accumulated in the lysosome. It will be accumulated there because lysosome only just break down glycogen directly with lysosomal acid alpha 1,4 glycosidase directly. So it breaks them down directly. So when these enzymes are absent, lysosome, the glycogen storage will be high in the lysosome, and if it's high in the lysosome, it will affect the heart. It will also affect the muscles. So patient here, due to the accumulation of glycogen in the heart, you will have what we call cardiomegaly. What we call the hypertrophic cardiomyopathy. Hypertrophic cardiomyopathy is when the left ventricle will be hypertrophic. Are you getting now? There will be a lot of proteins accumulated there, just like amyloidosis. Now in amyloidosis you have accumulated what we call unfolded proteins, but here glycogen will accumulate especially in all the part of the heart, in major in the left ventricle, and when it's packed in the left ventricle, which means the cardiac output will be reducing. So the next one, there will be muscle weakness, because why? It will be packing up in the muscle, causing difficulty in contraction. Cardiomegaly, because it will pack in the heart, causing the muscle, causing them to accumulate, and it will be damaging them. Hypotonia, it will be causing hypotonia because there will be flaccid paralysis. Flaccid paralysis because the neuromuscular transmission is low. Also respiratory failure, because it will pack in the lungs, causing difficulty in the lungs to contract. And death will come because the patient cannot do anything. So remember Pompe's disease. Pompe's pump. Von Gierke's disease, what will it affect? Von Gierke's disease, it will cause hypoglycemia, hepatomegaly, failure to thrive. The patient will have failure to thrive. It will start affecting various organs in von Gierke's disease, hyperuricemia, hyperlipidemia. But in Pompe's disease, what happened? There will be organomegaly, organ enlargement, which is the heart. The heart will be affected. There will be cardiomegaly. Pumping of the heart will be hard because of the left ventricular enlargement. Muscle weakness in M. So P for pumping of the heart, which means affect the heart. O, organ enlargement. M, muscle weakness. P, poor prognosis. There will be poor prognosis because the patient heart, due to hypertrophic cardiomyopathy, what happens? The heart cannot pump out blood very well, reducing the cardiac output, reducing the ejection fraction, and causing murmur. There will be early death fast in Pompe's disease. Cori's disease, type 2, very poor carbohydrates. Now Now, in this Cori's disease type 3, there's absence of debranching enzymes. So what is debranching enzymes here? The debranching enzymes is what? Your alpha 1,6 transglucosidase, alpha 1,6 transglucosidase, or alpha 1,4,1,6 transglucosidase. So when there's absence of these enzymes, what happens? Which means you cannot break down limit dextrin. Are you getting me? You cannot break down limit dextrin. So if you cannot you cannot form limit dextrin, because you have to break down the glycogen to form limit dextrin. Are you getting me? So if you cannot break it down, what happens? There will be accumulation of glycogen in this part. So there will be accumulation of what? Glycogen in the what? Liver and in the muscles. So here there's incomplete breakdown of glycogen, leading to accumulation of glycogen called limit dextrin. And when there's accumulation of glycogen in limit dextrin, what happens? It will accumulate in the liver, causing what? Hepatomegaly. It will cause mild hypoglycemia. It will cause muscle weakness. It will cause fatigue. It will cause growth retardation. Are you getting me? It will cause growth retardation. So now the next one is Andersen's disease. That is glycogen storage disease type 4. What will happen to this patient? This one is deficiency of branching enzyme. Type 4, deficiency of branching enzyme. Type 1, von Gierke's disease, deficiency of Glucose-6-Phosphatase. Type 2, deficiency of what? Lysosomal what? Alpha 1,4 what? Glucosidase, which we call acid maltase. Are you getting me? Type 3, deficiency of the branching enzyme. Very poor carbohydrate, and this Andersen disease, deficiency of branching enzyme, amylo 1,4,1,6 transglucosidase. So when there's a deficiency of amylo 1,4,1,4 transglucosidase, what happens? There will be what? Formation of abnormal less branch glycogen. Are you getting me? So this play will accumulate in the liver, in the muscles, in the heart, in the spleen. They will all accumulate there. Now, the glycogen will form, though, but it will be long. Are you getting? It will be forming something like amylopectin, amylose. It will be very long, but they will be formed. Now it is glycogen, but it's just that the glycogen is less toward branch. So if you pack in the liver and the spleen, you have what you call hepatosplenomegaly. There will be liver cirrhosis because the liver will be damaged. So if there's liver cirrhosis, you'll be seeing jaundice. And if you see jaundice, which shows that liver is damaging, so what happens? Your body will start recycling what we call xenobiotic substance, start recycling toxic substances. There will be early death before 2 years old because your body will be filled with so many toxic substances, because there's cytochrome enzyme there that helps you to break down and detoxify all those toxic substances. There will be growth retardation because your liver contributes to metabolism to give nutrients for growth. Coagulation defect, you cannot form blood clots. You cannot form blood clot because your liver releases some enzymes that are involved in blood clotting. So you see now, remember Andersen's abnormal branching. Now Cori's disease is debranching. Andersen's branching. Cori's debranching. So there will be cirrhosis, there will be liver damage, there will be jaundice. So we have done type 4. The next one is type 5. In type 5, now what happens to the patient? In type 5, we call it McArdle's disease. Are you getting now? Very poor carbohydrate and muscles. Now, very poor carbohydrate and muscles. So when you remember McArdle's, you remember muscles. In McArdle's, there is deficiency in what we call glycogen phosphorylase. Now, when there's deficiency of glycogen phosphorylase, what happens? Because this is the rate limiting enzyme that breaks your limit dextrin to glucose 1-phosphate. They break down your limit dextrin to glucose 1-phosphate. So when these enzymes are deficient, you'll be accumulating limit dextrin so much, your glycogen level will be high. If your glycogen level will be high, it will affect your muscle. So remember McArdle's, remember muscle. Which is von Gierke's disease. Very poor Pompe's disease. When you remember Pompe's disease, you remember pumping heart. Very poor carbohydrate. When you remember Cori's disease, you remember what you call, you remember the branching enzymes, you remember hepatomegaly. You get it now? You also remember mid hypoglycemia. So when you remember carbohydrate, you remember hepatosplenomegaly. So when you remember McArdle's disease, you remember the muscles. So there will be muscle weakness, there will be muscle cramps, there will be exercise intolerance, you'll be feeling fatigue anytime you are moving your muscle. There will be myoglobinuria, which means your body will be releasing myoglobin to your urine, so your urine will be dark anytime you're exercising. Are you getting the what we call second wind phenomenon? What is second wind phenomenon? Symptoms improve after short rest. So when you relax, the symptoms will improve and also increase again. So McArdle's disease, don't forget. McArdle's disease, remember, muscle deficiency of glycogen phosphorylase that break down limited to what? Glucose-1-phosphate. Debranching enzyme, you can see debranching enzyme in what we call the third one, which is what? Cori's disease. Cori's disease, debranching enzyme, while Andersen's disease, branching enzymes. Heart disease is type 6. In type 6 you have heart disease. There's deficiency in what we call glycogen phosphorylase, or again in now, but this one we have muscle glycogen phosphorylase in McArdle's disease and liver glycogen phosphorylase in heart disease. The same thing, there will be accumulation of glycogen, preventing glycogen to be broken down to what? Glucose-1-phosphate, preventing it to be broken down to glucose-1-phosphate. The first one affects the muscle cells. The second one causes what? Hepatomegaly, mental retardation. I get him now. Mild hypoglycemia. You get it now. So this one has disease is not usually, it affects the liver more. Hepatomegaly accumulates there. Since it's not forming glucose, there will be hypoglycemia, there will be growth retardation. I get him now. All these things remember has for hepatic. Remember McArdle's for muscles. McArdle's for muscles, has for hepatic, which is the liver. But in this case, there will be mild decrease in all these components. Your growth retardation will not be affected like that. It affects sometimes. Hepatomegaly will not be seen like that. You get it now. Type 7, you have the Tarui disease. Tarui disease is type 7. Type 7 Tarui disease. In Tarui disease, what happens? There will be deficiency in what? Phosphofructokinase 1. Phosphofructokinase 1 is important in converting what? Fructose-6-phosphate to fructose-1,6-bisphosphate. So absence of phosphofructokinase 1, which is a rate limiting enzyme, absence of it now will prevent the formation of fructose-1,6-bisphosphate. And when there's absence, are you getting now? There will be ATP drop production in the muscles and the RBC. So one thing you have to remember is that, RBC needs glycolysis pathway. RBC needs glycolysis pathway in order to what? Offload oxygen. So without glycolysis pathway, RBC cannot use what we call glycolysis without phosphofructokinase 1. So patient will be seeing what? Also muscle cramps, there will be dehydration, there will be tiredness, exercise intolerance, myoglobinuria. When they are exercising, after exercising, if they urinate, they will see their myoglobin, they will be seeing protein coming out from their urine, and due to inability for hemoglobin to be formed very well, what happened? There's low oxygen level affect the red blood cell, causing hemolytic what? Anemia. So remember Tarui disease, tired plus anemia. Your muscles will be tired and you become anemic. Why? Because there's defect glycolysis in RBC, because RBC needs glycolysis to offload oxygen from hemoglobin. So when there's no this condition, when there's no this pathway, what happens? Your oxygen level, your RBC, the glycolysis in RBC will be impaired, causing hemolytic anemia, because there will be reticulocyte formation and your body will not be able to recognize that RBC and start breaking them down. The last but not the least is type 8 and type 9, which is phosphorylase kinase deficiency. In this condition, there is deficiency in phosphorylase kinase. And what is phosphorylase kinase used for? It will increase glycogen phosphorylase formation. Remember, in our last video on glycogen metabolism, we do the regulation, which you say when you increase epinephrine, what happens? You increase calcium now stimulates the release or the activation of phosphorylase kinase. When you increase phosphorylase kinase, what happens? Phosphorylase kinase will stimulate the formation of glycogen phosphorylase, which will break down glycogen. But now there is deficiency of phosphorylase kinase. So what will going to happen now? Phosphorylase kinase will be deficient here, causing what? Accumulation of glycogen. Then what will happen? There will also be hepatomegaly. There will be what? Mid hypoglycemia. There will be growth retardation, and all these things are just common deficiencies. So phosphoryl kinase, remember, kickstart breakdown. Kickstart breakdown. So if phosphoryl kinase is missing, glycogen breakdown cannot start properly. Glycogen breakdown cannot fall because phosphoryl kinase induce glycogen phosphorylase, which is the rate limiting enzyme. So when this thing is absent, it will not start very well. So now, one key exam note you have to know here, the key exam fact you have to know here is simple, that liver you have hypoglycemia in type 1, 3, 4, 6, 8 and 9. Type 1, 3, 4, 6, 8 and 9. Your muscle intolerance needs 5 and 7. 5 for McArdle's disease for muscle, and Tarui disease because of photofructokinase 1. McArdle's disease, so 5 and 8 for muscle, 1, 3, 4, 6, 8 and 9 for liver. Are you getting now? Your heart needs 2. Your heart is 2, which is the Pompe disease. Are you getting now? So memory check, always remember, memory check, you have 1 is severe, 2 for heart. 1 is severe, which is von Gierke's disease, hyperuricemia, hyperlipidemia. 3 is your limit dextrin. 4 is the branching enzyme. 5 is for your muscle McArdle's disease. 6 is for mid liver. 7, all this thing I've given you. In the summary now, in this summary table here, to wrap up all I've talked about, so you see all this in this summary table, you use it. Von Gierke's disease, glucose-6-phosphatase, you see the condition it causes. Pompe's disease, what does it cause? Pompe's disease, lysosomal acid alpha 1 4, all these things are here, I've given you. Now to round it up, in the clinical correlation here, what happens? We have what we call G6PD deficiency. In G6PD deficiency, there's a reduction in G6PD. Your glucose-6-phosphate dehydrogenase deficiency is there, causing a decrease in NADPH formation. In G6PD, which is glucose-6-phosphate dehydrogenase, that one is now in G6PD deficiency, there's a decrease in the there's a mutation in the gene that codes for glucose-6-phosphate dehydrogenase, and when there's a deficiency in that enzyme, what happens? There will be what? Decrease in NADPH formation. And when you have decrease in NADPH formation, what happens? You cannot reduce and oxidize glutathione. Because G6PD, which is glucose-6-phosphate dehydrogenase, helps you to do what? Form NADPH, which helps you to what? Reduce oxidized glutathione. Then when you cannot reduce oxidized glutathione, what happens? You induce formation of oxygen radicals. So when you increase formation of oxygen radicals, what happens? Hemolytic anemia will come. And if hemolytic anemia comes, the liver will be damaged. There will be hepatosplenomegaly. There will be jaundice because the liver will be damaged. There will be cirrhosis too. Hemoglobinuria. There will be hemoglobinuria because you'll be urinating your hemoglobin. Why? Because your body is not forming mature red blood cell. It is breaking down the red blood cell. You break down the hemoglobin. The hemoglobin, you urinate them out. Then when you are breaking down all these things, you'll be urinating them out. What happens? You'll be have what we call AKI, acute kidney injury. So that is symptoms. So how can you aggravate this condition? By using what? Sulfonamide, fever beans, proguanide, and other drugs that you see here. So the treatment, you avoid all these any aggravating factor, and also people that are exposed to malaria has lower condition in getting this G6PD. They have lower condition. So I've given you many mnemonics here. Look at the mnemonics check. Look at everything here. It's done to help you to remember all these conditions very, very good. So now I'll be ending here today. Now always subscribe to my channel. All these PDFs, all these pictures I give you was derived solely for you to use to what? Get yourself to use to understand everything I've given to you. Continue subscribing, continue liking my channel, continue sharing it. You need this for your exams. Continue liking it. I will see you in my next video. Bye bye.